longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. Except tonight we're not going to have a doctor, but we're going to have two guests from All County Healthcare. Lou Biasi, Vice President of All County Healthcare Incorporated, and also Ed Salazar, Chief Respiratory Therapist at All County Healthcare Incorporated. Lou, let's get right into it. I want to start with you. What types of services does All County Healthcare offer to seniors and baby boomers population?
David, first I'd like to say to the listener, I wish you all a happy holiday and a happy Christmas and Merry Christmas, and the rest of the whole new year. May it be healthy and may it be prosperous for you on behalf of the folks at All County Healthcare. All County Healthcare, David, is a home health care agency, certified, Medicare certified agency, has a 4.5-star rating with Medicare, and also has a 5-star patient satisfaction rating. What are the services we provide? Just like every other home health care company, we provide physical therapy at home, occupational therapy at home, nursing at home, wound care, and we also provide a couple of services that a few agencies don't provide. Like one of the services we provide, behavioral health today, which is a very major problem all over the nationally. Behavioral health has become a serious problem. We also provide what we call a low vision program for those that are having problems seeing. And with the help of Ed, a couple of years ago, we started what we call, we put a team together, respiratory team, specializing in the COPD, knowing that what has happened in the last few years, the largest amount of readmissions to hospitals is COPD. We're the only company in the whole Tri-County area that's covering Palm Beach, Dade, and Broward County, which we happen to be licensed in. We happen to have one of the oldest licenses after 25 years. We have what we call Tri-County license. That covers Palm Beach, Dade, and Broward. And being one of the few agencies that treats COPD, they all say they treat COPD. Well, there's many methods of treating COPD. One was the old kind vest method, where the patient puts on a heavy vest and tries to help them. Ed came up with a program a number of years ago, 3 or 4 years ago, and they developed an IPV unit, interpulmonary percussive ventilation. Now that's what we're really pushing today at All County Healthcare. Matter of fact, we've cut a couple of ads. One's going to be on television, and those are the Delray. If you go to the Delray Theater, you'll see our ad at the Delray Theater, all the 5 theaters. Ed developed a respiratory team for us that goes into the home, gives you basically the same treatment that you get into the hospital to help you bring up that excretion that you can't bring up. That's, one of the hardest things, and really fearful, is when a patient can't breathe. When a patient can't breathe, he's totally in fear. And that's caused from a number of things, plus COPD. You're never going to cure COPD, but you can make the patient feel a lot better. As you can tell, I am suffering from bronchial condition cold. And today, Ed said, I'm coming down and giving you a treatment. Well, we did get a treatment. He gave me a treatment in my office today.
He was a real big boy. I was very proud of him.
He gave me a treatment in my office, which lasted 20 minutes. And after the treatment in my office, I could tell you, I felt my lungs just open up. It was the most amazing thing I've seen. I said, Ed, I feel like my lungs are really open up. He said, yeah. He said, that's what happens when you receive these treatments. So if you have a program and you're basically saying, okay, I got COPD, what do I do? Well, today, now you can call All County. We will try to steer you in the right direction. Of course, you got to get a doctor's order to get this treatment. We will come to the home with Ed's team. One of his team, Ed or a member of his team will come to the home and primarily give you the treatments that are necessary. And the treatments consist of the first 7 days. You get 7 treatments. They're in what, 20 to 30 minutes in?
Yeah, it's got to be at least a 20-minute treatment.
So minutes for treatment, as long as you can stay at 20 to 30 minutes. Minimum 20-minute treatment. And you get that for 7 days. And the next week you get 4 treatments, one every other day, again, for excessive treatment, and you can continue these treatments. Now, remember, under Medicare, this is at no cost to you. This basically comes, you're paying for it through your Medicare, but it does not cost you any money. There's no copay out of your pocket. It's the most, you under Part A, as you were entitled under Medicare to get home care, and that was granted to you in 1963 under the Social Security Reform Act. So under that, you got Medicare Part A and Part B. Part A covers hospitalization and also covers home care. Part B covers your doctor's visits. So if you're out there and you're wondering, well, how much is this going to cost me? Well, I like to tell you, it's covered under your Part A on your Medicare. And there's no copay in this thing. You go out there, we even provide you the mouthpiece that costs all. We don't get reimbursed for the unit. The unit's FDA approved. We get reimbursed for the nursing. But we've taken it upon ourselves to say, if this is going to help treat patients better, Ed went to a number of agencies, which I'll let him tell you, to represent this product called IPV, interpulmonary percussive ventilation, knowing we wanted to make the investment. All County made a well over $100,000 investment into these units. They've been going consistently, constantly, inconsistently since we had them. We started with one, and we're up to 5, Ed?
Yes, here I got 5 machines. Sometimes they've needed
Sometimes 6. So they're all out right now working with our patients. We've had tremendous, great response. If you go to our website, www.allcountyhealthcare.com, you will see it on our website, Respiratory Treatment. If you go to our Facebook page, you'll see all the comments of how the patients have really felt tremendously better. Now what we've done, what Ed has done, and the team has done, All County is saying, if you don't have Medicare, but you have private insurance or any other insurance that we don't accept, it can be paid for out of pocket. So these treatments are still available to you if you're on a Medicare Advantage plan, because your Advantage plan will not cover the treatment.
I see.
But we're saying to you, if you have your HMO or Medicare Advantage plan, and you have the means to do it for a small fee, we could treat you at home now. Because that's what's happening, because we don't want to deprive any patients from these treatments. Whether you're rich or you're poor, the question is these treatments can be done at home for you. And there's no need, if you're on oxygen or you're suffering, you have any kind of respiratory disorder, we will make sure you qualify. You will find out if you do qualify. If you do qualify, you got to get a doctor's order, and that can be arranged through your physician, right? And we try to get a doctor's order for you to give you the treatments. So now you're covered by Medicare, and you're also covered by cash pay. We'll take a cash pay for your treatments. So that's what Dave, that's what we're really specializing in right now. We do a tremendous amount of wound care. We're doing a lot of physical therapy for those that are just getting out of orthopedic surgery, whether knees or hips. But these are done by almost all the agencies. And remember, the one thing I want to stress on home care, which people don't realize, it's your choice. If a nurse tries to send you someplace where you don't want to go, listen, when I got into this business, I was a novice. I got into it because my dad got sick. He had dementia. I didn't know where to go. I got some help from May Boland where to go. We started I bought into the agency 3 months after my dad was being taken care of. Since then, we became Medicare certified. And I tell you, if you don't know where to go, or you want to try, you have questions, you can call Medicare and say, I want to get treated for this, this, and this. What agency in my area? It's amazing. We get a lot of calls. They said, we just called Medicare. They suggested your agency. So we got a pretty good rating with Medicare. They know we do the right thing. Out there, and I'm going to tell you right now, the people out there heard there's a lot of fraud going on in the home care industry today.
Especially in South Florida.
South Florida is one of the key spots. As a matter of fact, the whole game is changing in the next couple of years. But we still maintain a 4.5-star rating with Medicare. And one thing I'm very proud of, we have a 5-star rating as far as patient referrals, the patient satisfaction. And that was just done recently, so we're real proud of that. We're looking to get to be a 5-star rated company. We're privately owned. We're local, right? We're not owned by a big corporation. All the decisions are made by management. Right there, You don't have to wait to get a decision. You don't have to say, oh, I got to call my boss in New York or Chicago or California. This is locally owned. And today, if you want to do, I like to, me personally, I don't like the big box companies. I like to go to the local people. People who made an investment into the local community, who work in a community, hire community people. So we're locally owned. As today you can see, there's a lot of companies out there, Dave, that are selling. They're selling to big corporations. And when they do that, let's be realistic. They have to make a profit. They look at the bottom line. We look at the patient. We say, what does the patient need? Give what the patient needs, not what we're going to make at the end. And I think Ed can verify that. So, Ed, if you want, Ed, what do you think about the COPD?
Well, I was going to start out before you. The IPV machine, the listeners and viewers will remember, you brought it in here. I tried it out.
Right.
And it was a machine right here, IPV, if you want to talk a little bit about that. But that was the key part, is that mouthpiece is interchangeable.
Yeah.
Well, that's great,
Right.
and All County, like you said, Lou takes care of that.
Well, IPV stands for intrapulmonary percussive ventilation. And what it is, it's a therapy, it's a technology that allows the patient to have their aerosol, the aerosol that they normally take, to treat their condition. Along with this percussive therapy, it's given at very, very high frequencies. The frequencies range from 150 to 600 cycles per minute. And the idea is that this creates a percussive effect, but it's not external, it's internal. And because it's internal, it does a much, much better job of mobilizing secretions and what we call recruiting lost lung volume. COPD stands for chronic obstructive lung disease. And the obstructive part is just like it was in Lou's case. You have congestion, you have phlegm that gets into your airways, especially the terminal airways, down, at the ends of the lung where the air sacs are. Those are very, very small in diameter. And if they get plugged, it creates a huge problem, because now you've got part of your lung that is getting blood flow, but that blood is not getting oxygenated because of the obstruction. And what we do with this therapy is we clear those airways and improve the it's called gas exchange. The CO2 comes out of the blood and the oxygen goes into the blood, plus mobilizing the secretions.
If we were to take Lou's cough there as example, it sounds like it's a more productive cough than it was a couple days ago.
2 days ago, I couldn't even talk. And it said, let me come down and give you treatment.
So it's breaking up, and that's what the IPV does, breaks up that mess, that congestion.
Yeah,
for that time period. Then it needs to be done the next day. Like you said, it can't just be one 20-minute treatment and you're good. It's got to be over time.
high acuity COPD patients with stage 4 COPD. The number one reason they exacerbate, and by exacerbate I mean a condition where their symptoms get so bad that it starts becoming a dangerous situation. Okay, that's the point at which they visit the emergency room, and the emergency room admits them to the hospital, and the hospital gets them cleaned up, sends them back home. The reason there are so many readmissions for COPD is you've got this vicious cycle of the patient exacerbates, they go into the hospital, they get stabilized in the hospital, they get discharged home, then they exacerbate again. And what CMS is so...
What do you mean by exacerbated?
Well, like I said, their symptoms get so severe that it starts compromising their ability to breathe at all.
Okay.
So it puts them in a potentially very, very dangerous situation. So to prevent this cycle of exacerbation, hospitalization, stabilization, discharge, all county healthcare comes in at the discharge point. So the patient comes home, and if they're fortunate enough to be able to receive this therapy, then we greatly reduce the chances of them having another exacerbation and being readmitted. Right now in the state of Florida, about 9% of all patients discharged after an exacerbation of COPD are readmitted within 15 days of discharge. and it's greater than 20% for 30 days. And as I was saying, this is what CMS is so upset about, and this is why hospitals, home health agencies, physicians, everyone is starting to get a financial penalty for these readmissions. So all the hospitals are talking about, how to reduce these readmissions, how to create a transitional care program. And with All County, if these hospitals would partner with All County Healthcare, we could give them the IPV therapy while they're in the hospital, and we could have continuity in care. In the transition home, they could continue to receive the same therapy and prevent them from having these recurrent exacerbations and going back into the hospital.
Everybody...
We're going to take a quick break,
Okay.
and we'll come back, and on the other side, and we'll talk a little bit more about, why hospitals and those organizations haven't got on board and why they should on the You and Your Doctor Living a Longer and Healthier Life show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back. We're here with Lou Biasi, Vice President, All County Healthcare Incorporated, and All County's Ed Salazar, Chief Respiratory Therapist. Before the break, I was saying, how come Lou and Ed, how come the hospitals aren't just flocking to have these machines in?
That's a good question. And what they're doing right now, we are getting calls from Florida Medical Center. We've done an in-service, then we do it at Cleveland. We've done Florida Medical Center. We've done a number of in-services. And now the pulmonologists are getting to realize this here. One of the top pulmonologists in the country right now, who happened to cut our commercial, Dr. Keith Robinson, right there, has done a fabulous job for us. And he totally believes in it. And you go to his website, Keith's got his own pulmonary rehab down there in Boca Raton, down in Fort Lauderdale. Ed, you look very young, but what makes you an expert in this so-called IPV? I mean, how long have you been in this business? You're not a physician, but what are you?
I got into respiratory therapy in 1972. I bet.
What?
And the Dolphins were undefeated in 1972.
Yeah, don't remind me. I betted against them every game that year. I was still a Lions fan. No, I came down to South Florida to go to respiratory therapy school. And at that time, there weren't that many accredited programs in the country. But when I saw there was one in Fort Lauderdale, I was interested. I had been living in Michigan. I spent the first 21 years of my life there. But in the 45 some odd years, that I've been involved in respiratory therapy, I've seen a lot of technologies come and go. I mean, There have been some amazing advances, and then there's been a lot of things that have just kind of gone by the wayside. But I believe in this therapy. I believe it with all my heart and soul. When I was working clinically in hospitals, high-frequency ventilation is a common rescue measure. It's a protective lung strategy, and it's a rescue measure for very, very sick lungs. IPV is a gold standard in many trauma centers, in many burn units, many neonatal units. And so I was familiar with the concept. The whole idea made perfect sense to me. And then when I like I always tell people, I got seduced by the dark side. And I went from clinical respiratory therapy to marketing and selling of medical devices. And I was at a trade show, and I saw an exhibit with the IPV therapy, and it hit me like a lightning bolt. I said, my God, this is the solution to so many of the problems that we're having with our chronic patients in the home care setting, and not just adults. Our largest market is cystic fibrosis. For the people that manufacture the equipment, not for all county healthcare, but for the people that manage the equipment, cystic fibrosis is their largest market. I'm delighted at the results that we've gotten with COPD. Lou mentioned our team. Unfortunately, CMS, in its infinite wisdom, has declined to pay respiratory therapists for providing home care. So
that may change very shortly, though.
Well, it's been lobbied for a long time. But in the meantime, what we've done is I've trained about a dozen very, very capable RNs at all county healthcare, and they go into the patient's home and they deliver safe and effective IPV therapy in the patient's own home.
But they're all trained by you.
Yep, I've trained every one of them.
We're all trained by respiratory. So what we're talking about, when Ed goes there, we only get paid for the nursing. We give the treatment free. When I say the treatment, we give the whole concept with the mouthpiece, etc. That treatment is free to the patient. We don't build Medicare for the treatment. We build for the nursing factor of it. But the treatment has tremendous great results. Now, Ed, am I correct? There's been about 70,000 hospitalizations for COPD annually around in state Florida, or more?
In the state of Florida, it averages, if you take all the acute care hospitals in Florida and you totaled all their admissions for exacerbation of COPD, the number hovers right around 70,000 individuals every year.
And every time the patient goes into the hospital, the cost is about a 4.5 day stay. It's between $35,000 and $65,000 for they get charged for that. So we have been working with the hospital to do clinical studies. With each patient we do to report back to the hospital, we've kept patients out of the hospital as far as up to 12 months, 13 months, sometimes even longer. Am I right, Ed? We've had one gentleman who's had, I might mention, I met Ed through his wife, who was she was my director of nursing, and that's how I met Ed and his family. And since that, she's passed away a short time ago, and Ed and I become quite close as far as we're only interested in patient care. Ed has gone through it with his wife. I've gone through it with my own family. I've gone through it myself. Me being a senior, I realize the seniors are getting shortchanged. We don't want to get them shortchanged. So if you're out there, seniors, you're listening, you don't have COPD, but you know someone that does, or if your family member has something and your sibling or someone who has COPD or some kind of respiratory disorder, and you want to get in touch with us, get in touch with Ed, call our office at All County Healthcare, 954-717-7027. Please go to our website. I think it's www.allcountyhealthcare.com, and I think you'll see. We're ready to go?
No, we got 2 minutes, but you're also on Facebook.com/allcountyhealthcare. You guys now have a YouTube page. I looked today, there's 15 doctor interviews, videos up, so there's a lot of information. And the last few months, you've been in South Florida Hospital News, a healthcare report. The last few months, there's the latest and greatest. That's the December 1st issue. So if you want to learn a little bit more about All County Healthcare, SouthFloridaHospitalNews.com. Again, there's a ton of information, and this starts out about the Medicare certified home health care agency.
You know something, Dave, I know we only got a minute, but if you have any questions about home health, please feel free to call our office. Even if we can't serve you, call our office if you have any questions about it. It's 954-717-7027. Excuse me. Thanks, Ed, for that treatment.
You're welcome.
And also,
breaking up.
You're breaking up. And also, you got to understand that if you're on the verge of going on Medicare and you're 65 and you don't know what program to call us. We'll try to steer you in the right direction. We want to be a patient advocate. We want to advocate for seniors. They don't have an advocate.
No,
So we want to be the advocate in South Florida.
Well, I want to thank both you, Lou and Ed, for coming back on the program. Always a wealth of knowledge.
It's always our pleasure.
And it's a great show.
And David, if you have a wonderful, wonderful holiday, you and your family.
Thank you. You too.
And I hope Santa Claus comes around and treats you good.
Yeah, I hope so too. I've been trying to be good. We'll see you on Friday on the How to Stay Healthy show, 5:30 p.m.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed